Welcome and thank you for joining our event today on Health Inequalities, Are We Making Progress? Before I introduce our panel and our speakers, I'd like to say a few words about why we're holding this event and share our housekeeping rules. So today is the first year anniversary of the death of George Floyd, which sparked a worldwide movement to address racism and inequality. And like many other parts of the world, we asked the same questions in Greenwich. We held a public event last year and we invited those who commission and provide our health and care services to listen to the experiences of Black and Brown residents of Greenwich. And we asked service commissioners and providers to tell us what action they would take. So today we want to hear what they've done and what progress has been made and how we can shape and influence that work. But why is it important? In Greenwich, as in London and nationally, Black, Asian and minority ethnic groups are on the sharp end of health inequalities. Health inequalities mean Black and Brown people die earlier than they should. Black and Brown people have a poorer quality of health, unnecessarily living with poor health for years or decades, longer than they should. And let's be clear, health inequalities are unfair, health inequalities are avoidable, health inequalities are systematic and the result of institutional and systemic racism, amongst other factors. Of course, the causes of health inequalities are multiple and complex, and many of the influences like employment and housing are outside the remit of our speakers. Healthcare services are only one aspect, but a key influence on health inequalities. We believe that putting service users at the heart of and actively involving them in true equitable partners in the design and delivery of health and care services is key to reducing health inequalities, better health, and a better quality of life for all. So just briefly, our housekeeping rules. As Anastasia mentioned, please keep your microphone on mute unless you're speaking. To make best use of our limited time, if you have any questions for the speakers, please put them in the chat. If you're not able to use the chat box, or if you would prefer to speak, please raise your hand. Please be respectful. We've all come together today to work together today. And we are recording this event, so if you don't wish to be recorded, please keep your camera off. At the end, we'll be running a poll to find out how useful you found this event and if you'd like more events like this. So please do take part and let us know. So I'm delighted to begin with introducing our panel first and then our speakers. So our panel is made up of a small number of those members of our Healthwatch Black, Asian and Minority Ethnic Advisory Group. So in the room, we have Yannick Nair, Director of BME Volunteers. We have Lucy Isaiah, CEO of Black Female Entrepreneurs, Shola Adedipo, CEO of Food for Purpose, and Pamela Franklin, founder of the Caribbean Social Forum. So Pamela, Yannick, Lucy and Shola, if you can just put your hands up or wave so people can see who you are. Thank you. And I'd now like to introduce our speakers. So from Oxleas NHS Trust, we have Karen Edmunds, Head of Equality and Human Rights, Juliana Frederick-James, Forensic Equalities Lead, Sophia Plumaki, Associate Director, Greenwich Mental Health Services. So can I ask Karen, Juliana and Sophia just to wave so people can see who they are? Thank you. From the Lewisham and Greenwich NHS Trust, we've got Sandra Iskander, Programme Director, Strategic Development, Faye Blackwood, Associate Director of Organisational Development and Inclusion. Sandra and Faye, can you give us a wave? Thank you. And from the South East London Clinical Commissioning Group, we have Neil Kennett Brown, Place-Based Director, Greenwich. Thanks, Neil, for a wave. And from the Royal Borough of Greenwich, we have Fiona Harris, Assistant Director of Public Health, and Sarah McClinton, Director of Health and Adult Services. Fiona, are you waving? Thank you. Thanks, Sarah. Thanks, Fiona. So I'd now like to hand over to our first speaker from Oxleas. So that's Karen, Juliana and Sophia for their presentation.
Thank you. I think I'm going to present the slides, but Juliana and Sophia, feel free to chip in if I've missed anything significant. So we were asked to talk about what we've achieved in the last year. And I think this slide is a visual as well as a written representation of that. We've spent a lot of time reflecting on what we need to do. We've engaged with many of our Black, Asian and minority ethnic staff to get their feedback and for them to help us identify what our priorities should be. And this image just represents some of the things that we've actually done. So we've adopted new values and behaviours which focus on fairness and inclusion. And you'll see at the bottom of your screen, for those that you can see, our 4 values are there. We're kind, we're fair, we listen, we care. We've trained 50 Greenwich managers in Oxleas in cultural intelligence and inclusive leadership. We now have 33% of our board who are Black, Asian and minority ethnic people. We've done a film about microaggressions and microkindness that's aimed particularly at our staff in Oxleas, but it's there for anyone to see. It's on Vimeo and on YouTube as well, and it's called In Each Other's Shoes. We've hosted 15 online wellbeing sessions for our staff, and they're all facilitated by senior Black, Asian and minority ethnic staff within Oxleas. And now we've also undertaken something we always intended but wasn't always rigorously checked, was that all interview panels must include Black, Asian and minority ethnic panelists. So that's some of our achievements over the last year in terms of what we promised we'd do in terms of addressing racism and discrimination in our organisation, looking at sort of structural underrepresentation of Black, Asian and minority ethnic people within the leadership of the organisation, and also addressing the concerns of Black staff, Black, Asian and minority ethnic staff. Can we go on to the next slide, please? Thank you. So I thought I'd share with you just some an overview of some of our patient experience feedback surveys by ethnicity. We recognise that broadly they represent the people that use our services. However, you'll see from this graph that it looks like more people who are white tend to complete patient experience surveys than Black, Asian and minority ethnic people. So one of our things that we're now looking at in the current year is how we make sure that our patient experience data is more representative of the local populations and the people that use our services, and reaching out to people that we seldom hear from, including those who are the most deprived and vulnerable, and to listen to their experiences. And both those intentions are set out in Oxleas' strategy for the next 3 years as well. Next slide, final slide is, well, what next? So in our strategy, which sets out what we want to do over the next 3 years, our key aims are to achieve 0 delays for people using our services, delivering great out-of-hospital care, and also making Oxleas a great place to work. So in terms of achieving great out-of-hospital care, it really is about co-designing our services with those who use them and their families and their loved ones, but also working closely with our partners, including local GPs, voluntary and community sector and other local providers. Our vision for this is that nothing should be about us without us in terms of how we deliver patient care. So those of us that are using NHS services and so nothing should be about us without us. But to achieve that, we know we need to do some work. So we're looking at new resources and infrastructure to support patient and public involvement. So that includes a dedicated lead for involvement to increase the opportunities available, and also an involved steering group, which will comprise of our governors, because we're a foundation trust, our quality improvement lead, service managers, leads for the lived experience programme we have, volunteers and memberships, and also family and carer leads. but also including some key external partners, including people in the voluntary and community sector. So what we're aiming to achieve is much better and inclusive engagement with people in our local communities and those that use our services. I think, is that my 3 minutes? I don't know if Juliana or Sophia, you want to add anything?
No, I was just going to say that, you know, I think it's been a challenging year for everyone. And what we're hoping is that some of the cornerstones of what it is we want to achieve are being set this year. So it's kind of, we've started on our journey, and it's going to be a long-term journey, but we are heading in the right direction. So we're really pleased with what we've got. That's all I would add.
Thanks, Juliana.
No worries.
Thank you, Karen. Thank you, Juliana. Can I ask the panel if they have any questions for Karen and Juliana? So Pamela, Yannick, Lucy and Shola, are there any questions that you would like to ask of Karen and Juliana before we open up the questions? Can't see anyone unmuting.
Yes, I would like to ask some questions.
Sorry, who's that? Is that Lucy?
That is Lucy.
What's your question, Lucy?
I just thank you, Karen, for that excellent presentation. And I've said, just want to use this opportunity to thank all the NHS staff for the work you've done over the COVID. And just Greenwich has actually put in a lot of energy in terms of making sure things get done for people in our community. Thanks for your hard working. One of my questions is going to look at the cultural intelligence. I know you were talking about 50% where these are training being done by staff from your team. But I would like to put to you and the team that most people that face health inequality are from deprived community, the deprived BMA community. So, and for you to be able to understand what people actually go through and then be able to give advice, you need to speak to those people that is being affected. So I would like to know what knowledge those your staff that actually help in giving the training or are part of, what knowledge do they have about the deprived community of the BMA in Greenwich in terms of those with no recourse to public fund that will not even access NHS, that find it difficult. And also in terms of those that English might not be their first language, and when they go to GP, they are being, sometimes the health system or the GP, because of the time, they now act like a native doctor, you know? It's like they can actually, like a soothsayer. Before you say anything, they actually understand what you want to say, and you're being dismissed from the hospital. What information do you have in regard to those people? And also the elderly, the Black, the BMA elderly, especially the African elderly, we find that there's a lot of cases about them whereby they don't get enough support in terms of how they access NHS, how they access services, people understanding their cultural diversity, that when they get to this certain age, there is a way that they need to look after them, even down to the care home. We've seen some care home not even understanding the cultural difference, that the food, that the way you address these people need to have the cultural intelligence to do. That's my first question. Then my second question now goes to, your data actually shows that a lot of the people that does the survey are from the white ethnic background. So,
Lucy, can we take one question at a time? Because
okay. All right, then that's fine.
So if you can just repeat, what was your first question?
My first question is regard to how the staff that give the cultural intelligence, what is the knowledge of your staff in terms to people that have been affected? Because majority of people that are affected by the health inequality are from the deprived community, from the poor community.
Okay.
Yeah.
Okay, thank you. Karen, could you respond to that, please?
Yeah, I will do. So in terms of cultural intelligence and inclusive leadership training, we started with our board in October last year. We then rolled it out and started to look at how managers on the front line are supported to better understand the communities we serve, but their role in that as well. Everyone has to take responsibility for educating themselves and understanding the communities that they work with, and also the staff that work in our organisation. So it was really important to start with those managers, because how those managers manage and support our frontline staff is key to those frontline staff delivering really good, appropriate patient care. A lot of our staff come from the communities where we deliver our services. So we're a community and mental health trust. So a lot of our staff live locally, so they are our community as well. And you're right in your question that I can't guarantee you that every one of our staff knows everything they should know in terms of understanding different cultures and communities, because that would be, that just wouldn't be true. So we're on a journey to make that a reality. And part of that is giving people training, having those conversations. So with our film that we've made around in each of the shoes, we're taking that out. One of my team members is taking that out to our frontline teams to have discussions about microaggressions, about racism, about understanding people that maybe have a different culture to our own. So that's kind of, it's a journey we're on. I'm not saying we've reached the improvement we're seeking. It's very much the start of a journey. And you're right, we need to be talking to the people that use our services, which is why in our strategy, our focus is going to be on co-design, co-production. So involving people that use our services in how we improve them and how we deliver them, which I know is something that Healthwatch is really keen that the NHS does. So I hope that answers that first point.
Pamela, before, we've got a question from Pamela, Lucy. So I'll move to Pamela and give Pamela the chance to ask her question, and then we'll open it to the floor. Any other questions, please do put in the chat and we'll come back to them if we've got time, or we'll answer them outside of this event. Pamela, your question?
Yeah, I want to echo, first of all, thank you for inviting us to the Caribbean Social Forum, and I want to echo what was said by Lucy, by the work that's been done by the NHS, especially within Greenwich and so forth. My question is, it's great that you've done all that training, and before that's the sort of training I used to teach at NHS. I know it's important. What didn't always work is that the training is one thing, and people attending the courses, but how they apply it is another thing. And what we found in the past when I was working in that sector, that often no one was monitoring if what they were being taught in the classroom was actually being activated in the day-to-day running of the business. And that included working with directors to see if they were actually monitoring it and putting it into action. And quite often it wasn't. And therefore the patient didn't actually see any change, because whilst the training was great and people enjoyed it in the classroom, they found it quite difficult sometimes to come back and know how to apply it, having been doing something the same way all the time. So that could also have an impact to what questionnaires you get back, because in your eyes you've seen change because you've done the training, but in the experience of the patient they haven't seen change. And mental health within the Black community, especially amongst the men, the number of people within the Black community that's been put into mental health institutions without proper referral or so forth, it's still on the increase and not on the decrease. So if this training, albeit it's new, would help to monitor that, then we could see results based on what you've trained them in a classroom. But if the numbers are still going up and the experience that the patient is getting is still the same, hence why they're not responding, then I wonder if there's a way in which the people who come in and watch and see the changes in action rather than just seeing the changes in a classroom. Thank you.
Thanks for that question. Thank you for that question, Pamela. I mean, I think the reality of the situation is that we all know everybody's got wonderful equal opportunities policies. I don't see anybody's policy that says we must beat people that don't look like us and behave badly to people that don't look like us. And yet somehow we end up not getting the best out of anything. So I think what's really interesting about the cultural intelligence training is that it's an opportunity for some of the stuff that you're talking about to actually be looked at. Because I think often what happens is we've got quite a large number of people who work in the trust who come from from Black and minority ethnic communities, and yet somehow we're not able to bring that experience to work with us, perhaps. And what we're trying to do is give people the tools to be able to say, it's important that we're able to empathize with people, to build therapeutic relationships with people. And that's what we're hoping this training will do. Now, we'll only see the fruits of our labor, as you say, when the people start to fill in the forms and say things are being done differently. And just so we're clear, we all see the figures. The figures about Black people accessing mental health services have remained the same for 30 years. They're not going down. So one of the problems we've got in the NHS is it's not always about us for why people end up in the service. However, it is our role to make sure that the outcomes are better. So if by doing some of this work, we're going to create you have to create the space to allow people to challenge things, to look at things, to say, maybe we should be doing this a bit different, and getting the feedback from people. So the cultural intelligence is one among many things that we are doing in Oxleas. Please don't believe it's the only thing that's going on, because I'm also the chair of the Black and minority ethnic community staff network. And I can tell you, it's really good now because we're harassing from the inside and you're harassing from the outside. And then there's other things going on up there from the NHS and also NHS England and stuff. And it's all coming together almost like a perfect storm. So, we should be seeing difference. And if we're not, this is our chance to say.
Very quick.
But it's exciting.
Thank you.
Yeah.
I'm sorry to jump in there.
Sorry.
We're really tight on time. We've also had a number of questions in the chat. What I'm going to do, we'll take those questions and we will come back with answers. It might be after this event, but I do have to move on now to our next speaker. Thank you very much for Oxleas NHS Trust for that first presentation. But I'd now like to hand over to Faye and Sandra from the Lewisham and Greenwich Trust.
Thank you. Right, thank you. It's a real opportunity to be here and just to share this event with you all. I'm Faye Blackwood. I'm the Associate Director for Organisation Development and Inclusion, and my colleague Sandra will also be presenting with me. Can I have the next slide, please? So we just wanted to do a very, very brief recap of what we said in July last year. And so we really talked about wanting to engage with our colleagues across the trust as well as local communities to just get involved with this dialogue and to support the ways in which we can really think about readdressing this historical and systemic imbalances. And from my perspective, really think about how they affect us in the workplace. As with all the other organisations on this call, the Trust is fully committed to tackling health inequalities and making the organisation a really inclusive place for all of our staff. More than 50% of our staff come from a Black, Asian and minority ethnic background and hold multiple identities. So for us, making sure that every single member of staff feels included in what we do and how we do it and how we deliver care is absolutely crucial. We've got quite a comprehensive equalities action plan that we have developed in conjunction with our staff and the feedback that they've given us. And we've developed that over many months and tested that with our colleagues. It's a bit of an ambitious plan, there's lots in there, but we know it will take some time to move through that. And we want to be able to continue working with our staff colleagues to achieve that. Can I have the next slide, please? So apologies, this slide might be a little small for people to see, and I think they'll all be shared. But what I wanted to do was just to give you a flavour of some of the work that we have been doing. So like I said, we've worked with our colleagues to develop this. We've listened to them. We've also looked at data that we have from people of all protected characteristics. And we know some of the areas of focus that they wanted us to pay attention to. So recruitment and employee relations is a key one. We've completely had a look at the process because we understand and we could see from the data that staff were not progressing through the organisation as equally as they should be, and also that when we looked at who was going through disciplinary processes, it was disproportionate. So we've completely looked at our job evaluation process to make sure that that's right and people are paid accordingly. We've reviewed our recruitment handbook and training. We now have 46 trained equality advocates that are sitting on all of our recruitment panels, and they have the authority to stop a recruitment process if they think that there's any element of unfairness that's happening. All of our internal secondment, acting up, temporary staff movements and so on are all fair and transparent and fully visible across the organisation now. Our disciplinary checklist process has been completely revised with our staff side, and so before anybody enters into that process, there's a whole process that looks at, is this the right thing to do, is this necessary? In terms of increasing representation, we've done a lot of work in relation to skilling up our staff, our internal staff. So we have a number of internal coaches that come from a wide spectrum and representative across the organisation. And they're there to help our staff who want to progress or want to move into different roles with CV, interview prep, coaching, and so on. And thinking about early and late careers as well. So there's that internal support. I think a previous speaker spoke about people having the space to be able to speak up in the organisation. And so again, we've really kind of looked at our induction process and making sure that we're absolutely clear with people from day one that we encourage them to speak us, to tell us when we're not getting things right. And we have a whole Speak Up Guardian in the organisation as well. We have over 150 wellbeing champions across the organisation, again spanning all the demographics, staff roles as well. And they are there to support mental health and wellbeing as well as physical, signpost people to things that are available. Of that 150, we've had 30 trained. We've just had another 15 trained. That's probably got about 45 in total now that are trained in mental health first aid and facilitation skills. And we're also strengthening our leadership capacity and capability. And we've got over 141 staff on leadership and management programs that we're funding through the apprenticeship model. In terms of our networks, again, another area that enables people to have a voice and be able to speak up and to be able to really contribute to the work of the organisation. Here, I've just spoken about the disabilities network, because that's one of the things that we've done since July. But we also have a women's network, an under 30s network, and of course a Black, Asian and minority network. We've done a number of different things since last July, and some of them are listed here in terms of sort of doing things around Black History Month, LGBT History Month, work around mental health awareness, and so on, and ongoing work around faith events throughout the year and bereavement practices. This week, for example, we have a lot of work going on. Our networks have put together a really diverse number of events. We have today and on Friday, they are hosting a sort of Meet the Network event around lunchtime, where people can just come, meet people that are in the network and join and do more. They're also doing some work around just commemorating the fact that George Floyd has died a year ago today, and the whole Black Lives Movement matters, and selfies and posters and so on. And then we have a weekly webinar that's hosted by our Chief Executive, and that's being taken over this week. And that will be completely focused on EDI. In terms of our senior leaders commitment, before I hand over to Sandra, just the last thing I want to say about our senior leaders commitment to the agenda, and just making sure that they are cited on what we're doing. The Workforce and Education Committee has a complete theme around equalities, and that goes to them every quarter, and that is a sub-board committee. We have a whole reverse mentoring program that's underway as well, and we've got 32 mentors and another cohort that's just about to begin. And all of our executives are sponsoring a network, and they all have equality objectives and work within the Res Expert program. So
Great,
that's
thank you so much. Sorry to interrupt, just if we can keep things moving so we can keep to the timings of the event, that would be great.
Sure, sorry, Sandra.
Thanks, Faye, and I'll be as quick as I can, Anastasia, and then people can ask me questions if they'd like more detail. So I'll just talk a little bit about the work we're doing to try and address inequalities amongst our patient population and amongst our communities. So we do have a health inequalities working group set up, but as my colleague from Oxleas said, this is really a long-term programme which we expect to be working on over many months and years. And I'll just draw out a couple of highlights. So we're doing a bit of work to try and identify whether there are differences in outcomes amongst our patient population, and as an example, in maternity we've done a lot of work around continuity of carer and having specialist teams for vulnerable women to try and make sure that we address those inequalities. We're doing some work to analyse our waiting list to identify whether there's any differences amongst people waiting. Obviously you'll know that our waiting lists unfortunately are much longer now due to COVID. We've not seen differences yet amongst different populations, but we'll do a bit more work to check whether that's the case. We have a population health programme in Lewisham, which is trying to make sure that people with long-term conditions have their conditions managed well, and we think that there'll be learning from that we can apply to our other boroughs. We're thinking about whether there's more we can do around the prevention, so around long-term conditions, obesity, alcohol, smoking, and so on. So we're quite early in our thinking around that, but we hope to develop a programme of work in that area. And finally, we're thinking about the role of the trust in our wider community beyond health. Obviously, we're a major employer, we purchase lots of goods. So we're thinking about things like our impact on air quality, how we reach out to our communities for employment and so on, just to try and support our communities in a way wider than our health impact. If we could just go to the last slide, Anastasia, I won't talk about this, but we're really keen to get more people from different backgrounds involved in the work that we do across the trust. This slide gives you an example of some of the things we do, and I've put our email address at the bottom of our patient experience team. We'd love to hear from people who want to get more involved. I'll stop there.
Thank you so much for that presentation, really comprehensive. Can I ask the members of our panel if they have any questions? And do let me know. If not, we'll go to questions from the audience, and I've had one sent to me.
I raised my hand.
And there's yes, Lucy has her hand up, and also Susan raised her hand during the presentation.
Sorry, so Lucy, just one question from you, and then was it Susan you said?
Yes, Susan Rowe.
Lovely, thank you. Lucy, one question from you.
Okay, thank you for your presentation. I can see that you prioritize a lot of issues, which we bullet point, but looking at the topic we're discussing today, which is health inequality affecting BMA community, I did not see in your PowerPoint that you actually prioritize any of those health issues that is affecting the BMA community. Is that something that you'll be looking into to prioritize it as something moving forward?
Thanks, Lucy. Shall I take that, Faye? I mean, I think possibly because I've just gone through this so quickly, it's probably not come through the work that we're doing. So, for example, in our maternity services, we've done a lot of work around Black women in particular, making sure they have a better experience, making sure that their outcomes are better. And that's work such as making sure that they have the same midwife throughout their care, that if they are facing issues, someone talked about, for example, people with no recourse to public funds earlier, we make sure we signpost signpost them to charities and other organisations who can help. So there is quite a lot of work going on, obviously not as much as we could do, and we should do more, but I think just because I've gone through it so quickly, I've probably not pulled it out in as helpful ways I could have done.
Yeah.
But happy to come back to you, Lucy.
In the future, it would be great if that is highlighted and prioritized and a target and said, in the next couple of years, we mean to meet 10% of this or 20%. So maybe in the next time when we have a meeting, we can ask you, what is your outcome? What have you prioritized? What have you done in terms of maternity? What have you done in terms of this? So that we know that we are moving forward. When we classify everything in one box, that is how a lot of the BME miss out in things. So if we can highlight and prioritize it.
Thanks, Lucy.
Thank you, Lucy. Susan.
Oh, hello. Good morning. First of all, thank you to everybody who works within the NHS, especially what you've been through in the past 12 months plus. And thank you so much for inviting me to this meeting. I actually come from the Lewisham Education Group and trying to also work with the NHS Lewisham to actually just view what you guys are doing also as good practice. And looking at statistics of young African Caribbean students in our borough in terms of education has been quite stratospheric. I've also got a daughter who is studying paediatric midwifery in a completely separate place. And this is a question that I've always wanted to ask. I've asked it in the education things. I'm going to ask it for the NHS as well. My daughter's currently actually experiencing serious low-grade racism from fellow colleagues, white senior maternity staff. It's a catch-22. You complain, you get seriously harassed and ostracized. You don't complain, she's internalizing it and it becoming a mental health issue. So one of the things that I wanted to ask was the people that have been in place and in power for a long time, that has basically watched these statistics for a long time, has anybody ever really asked them what was the justification for this just simply being okay in a multicultural society? Thank you.
Who would like to, I think we can't answer your specific question, Susan, about the experience of your daughter, although I would like to think that there are, sort of whistleblowing supports at the institution that she's working within that might give her some support. But who would like to answer the question on health inequalities and essentially why it has been an issue for so long, and why do we keep having to raise the issue, and why do we keep hearing that services are addressing the issue, but we don't seem to be as far ahead as we might like in addressing health inequalities? Would any of our speakers like to talk about?
I'm happy to comment, Joy. I mean, it's a really big question, which I'm sure I can't answer all of it. I mean, I would echo what you said about, there's lots of organisations now have to have a way for people to speak up. So would really encourage people to find out about what their organisation provides for that. I mean, I think on the subject of health inequalities, I suppose from a health service point of view, we are just one part of the story, as you discussed at the beginning. I mean, there's all sorts of things that have an impact on inequalities, your job status, your housing, and so on. So it is much wider than one organisation, which I suppose makes it more complicated. But I think also echoing what you said at the beginning, I think recent events around COVID, Black Lives Matter, and so on have really brought it up the agenda, and I think it's getting much more attention than it has in the past. So I would feel optimistic that we will start to see some change.
Thank you, Sandra. And I've had one question as well that I'd like to ask. There's a huge amount of work, obviously, that's gone on within the Lewisham and Greenwich Trust. Are you able to describe what different service users will see? So the average person using the Lewisham Greenwich Trust services, is there any difference in terms of what they will see in their sort of day-to-day? What impact is it having on their day-to-day experience, particularly those from Black, Asian, and ethnic minority communities?
So I think it will probably depend on what service we're talking about, Joy. But what I hope is that, especially if you know, I reiterate the message that we really want to get people involved. So I would like to hear, for example, I'll just give you an example. We got lots of feedback that we weren't so great at dealing with people with hearing impairment. So we've put in training for staff to try and help them identify where someone has a hearing impairment and give that person additional support. So I'd like to think in that example, if you were a person with hearing impairment who came into the trust, you personally would feel a better experience as a result of that. So I think it's things like that where in a specific circumstance, I hope people would see an improvement in the way that they're experiencing their services at the trust.
Thank you. I'm going to move us on now to a presentation from the South East London Clinical Commissioning Group and the Royal Borough of Greenwich. So I'll hand over to Neil, Fiona and Sarah.
Thank you very much, Joy. So I think I'm going to kick us off, and thank you very much for inviting us here today. So I'm Sarah McClinton and I'm the Director for Health and Adult Services in the Royal Borough of Greenwich, and that includes responsibility for adult social care services and public health services. And I'm joined by my colleagues Neil and Fiona because we made a series of commitments across health and care last year, and we wanted to make sure that we were thinking together about our response and about what's happened and what's been achieved over the last since last year. And that includes, you know, thinking about the whole range of health and care services, from things like NHS waiting lists and how do we need to think about those differently, perhaps from the way that we've thought about them historically, to thinking about care homes. And someone has already earlier raised that issue about cultural competence in care homes, so down to that thinking about that individual and what they need, through to, you know, practical examples where we've worked with people with no recourse to public funds, for example, and worked to get people who are undocumented into the vaccine programme, which in a centralised sort of NHS way of doing things, you know, wouldn't happen. So I think, and just on adult social care, to say that we've also, Cabinet across the borough agreed in January a new vision, which is a very strengths-based approach to social care services. So really thinking about people's strengths, what people's potential is, and that strength in diversity is a really key part of that and a key pillar of that work. So I think people have been reflecting on the kind of disproportionate impact of COVID, and it's really clear that that wasn't generated by COVID. I think someone made a comment in the chat about, you know, or it was perhaps Joy's question about if this has been going on so long, why is it so difficult to shift? But COVID certainly revealed, I think, those inequalities much more sharply. I think Joy used the kind of storms and boats analogy, where, you know, we were all in the same storm, but actually people's individual experience, some people were in a very different boat. And I think we learned through our work with shielded individuals that actually someone's condition, their medical condition, wasn't necessarily the thing that made them vulnerable. And lots of people who weren't shielded were more vulnerable. And some of those that were shielded were actually well connected, well able to access the things that they needed. So, and I think that what part of the learning is that we can't make any assumptions about our diverse communities. So different communities will have different experiences, different issues, and individuals will indeed have very differentiated experiences, and understanding that in detail, I think, has been really important in some of the work that we've been doing through our community development work. So, I think that work's going on at, you know, both a London-wide level, but across South East London, and locally at place level, but also at that hyper-local level. So I think what we wanted to do was just to reflect on some of the commitments made and what's happened in relation to those. But Neil's going to talk particularly about what's happening across South East London, and then using the vaccination programme as a bit of an example of how actually coming together locally to work with the NHS on a very centrally led programme brings different assets and resources and thinking to how we have a more differentiated approach to our local communities, indeed at a very hyper local level. But I think, as Juliana said earlier, this is very long-term work in terms of shifting what are significant challenges and inequalities which are not confined to health, but actually confined as a result sometimes of those wider determinants of health, and some be that housing, access to employment, or indeed structural racism. So the key commitments were around engaging with communities, and I think Fiona is going to talk a bit more about that, but focusing very much on those that are disproportionately impacted by COVID. And I think there's quite a lot in the chat about some of the issues in terms of intersectionality there. So we know that there's been a disproportionate impact in terms of older people, people with learning disabilities or other long-term conditions, by occupation, for example. So we know that people working in the care sector who often are on minimum contracts and a minimum wage, the disproportionate impact on that group, they were much more likely to have severe disease and die as a result of COVID than, for example, people working in the health sector. And those links to deprivation and those wider social determinants. So how all of those things intersect is really quite an important part of our understanding. But we made a commitment to enabling people to influence the shaping of services, and we've done a lot of work on developing co-production, supporting and training staff. So within our organisations, and colleagues from Oxleas and Lewisham Greenwich Trust have already talked about some of their work. But similarly within the council, we've developed training and mentoring and various approaches to enabling people really to be having those difficult conversations in the organisation, and to speaking out against racism and discrimination. And then finally, the council as a whole has agreed, and again this has been agreed at Cabinet, an Equality and Equity Charter. So that is both outward facing in terms of the work that the council does with local communities and is led by Adele Kyra, so the Cabinet member for communities, and that also has within it an inward looking, if you like, or an organisational group that is led by the one of our executive directors, looking at what needs to change inside the organisation, as well as I say, externally facing, working with our communities. So I'm going to hand over at this point. If we can move to the next slide, and I think that's
Thank you. Thanks, Sarah. Yes, I'm Neil Kent-Brown. I'm the Borough Director for Greenwich for South East London CCG. I'm not going to go through all the detail of this. There's quite a lot on here. I just want to draw attention to a few things. First is mental health being a massive priority for us in Greenwich. And we know the pandemic and lockdown restrictions have impacted on all of our mental well-being. So since last July, our team have run 2 phases of a campaign called Free Your Mind, which is about trying to encourage people to take action about their mental health and well-being, helping to signpost people for self-help, as well as actions people can take to look after their own mental health, as well as easier to access services. So the awards the campaign's won a number of awards, and we've reached about 1.5 million of our 1.9 million population and had very high engagement rates. And that's particularly amongst the Black, Asian and minority ethnic residents. So hopefully people have been aware of that. But we know that there's so much more that we need to do. And interestingly, we know that the Black population in particular is overrepresented often in adult mental health, but underrepresented in child and adolescent mental health. So there's a whole question about how do we appropriately do work earlier in life in order to try and prevent that development of mental ill health through life. An awful lot of work we've been doing around vaccination, and I will come on to that very shortly. I did want to just draw attention to some of the important work we're doing around learning disabilities, where we know there are significant inequalities. And this is, the title of this is around overall inequalities. We know mortality is about 4 to 5 times higher, and people have quite often quite a short life expectancy. And so what we're trying to make sure is that the comprehensive annual health checks happen. And we've seen a significant increase, about 20 to 30% in Greenwich. And we've put additional training resources and best practice in to try and drive that work forward. I'm going to hand over now to Fiona briefly.
Hi, thank you, Neil. Sorry, could you go back to the previous slide, please? Sorry, I was just in the second half of this. So Sarah has mentioned about the council doing the Equality and Equity Charter, and that was signed in February, and I think there is more work going on to develop a sort of community-led network for that charter. And she talked about the work they've been doing with the staff around reaching for a racial equality group in RBG. But the work that I've been working with the community on is more about the sort of the engagement and community engagement. So the focus was on how we support communities to reduce the negative impact of from COVID. And we've had a number of different approaches at different levels. So we have a borough-wide community champion approach, which is about how we get the right messages out, trusted messages out to people in the right places. So we've got an initiative called Community Champions, which a number of you I know already signed up to, and we would encourage more people to sign up. We've got about 360 at the moment, and they have a reach of between 50 and 80,000 people between them, which is phenomenal. And actually it's about getting messages out very quickly, letting people know what's happening in Greenwich, and how they can get support when they need it. We also have a lower level sort of more on the ground support. So our deep engagement initiative, which are actually our neighbourhood champions, we identified initially 4 neighbourhoods that were particularly at risk of poor outcomes, and we've been working with them since September last year, and we've got about 80 people who regularly work with us, but they reach a huge number of people in the community, and it has been a phenomenal piece of work. I mean, I'm not saying it's perfect, because we're still learning, we're still getting that feedback, we're still trying to understand what we need to do, but the engagement we've had has been fantastic, and the people on the ground have been absolutely fantastic. So we've got 4 areas, we've now expanded it to 3 more areas. Again, these are areas where maybe we haven't worked before, that we didn't realise were at such high risk, and we've identified those communities and we're working with them. We're also at the same time working with other communities of interest. So we've been working for quite a while now with the Nepalese and Somali communities, but we're also working with the West African, the East African, the Caribbean, Bangladeshi, Pakistani, Afghani, Eastern European, Roma, and people with disabilities and younger people. And it's an ongoing piece of work, but it's actually trying to understand what has worked well, what has been real challenges, and how we can overcome that. And some of the consistency is about language, it's about communication, it's about actually how we get the messages out in the right way. And those are the things that we've been focusing on. So I will hand that back now to Neil for the next slide, please. Thank you.
Thank you. And if people are wondering why this presentation is a bit longer than the others, it's because we're actually joined the Royal Borough of Greenwich and the CCG update together, because actually our work is so integrated, we thought it was better to share together. So I'm not going to really talk much through this slide, but I did want to highlight that a lot of recommendations were made. There were 7 key recommendations that came about understanding the impact of COVID on the Black, Asian, minority ethnic communities. And basically there was a whole coordinated piece of work around public health, local government, the Greater London Association, NHS partners, all working together to say, okay, how do we support and work things through And there's kind of a London Health Board, which is chaired by Sadiq Khan. Danny Thorpe, who's the leader of the council, is part of that and one of the main leaders of councils involved in that. And there's this health equity group. What they've done is sort of highlight how we're going to progress against these 7 recommendations. And I just want to, I'm not going to go into the detail of those, but just to say we have been moving all those things forward. And then more locally within South East London, we've done some real key priority work about both capturing information. So we've got a population health and equality executive, basically tracking on a monthly basis how we're progressing against a number of key initiatives. One of those is dashboards, and I think it's, if you don't measure it, you don't know it happens. And I know quite a lot of the questions are about, well, what's the data saying? And some of the challenges, if the ethnicity monitoring and the data isn't there, then you actually can't sometimes track what the impact is. So we've been making sure that we've got that in place. And then there's a big program around the Vital 5, which are basically saying, if these smoking, blood pressure, obesity, mental health, and alcohol, if you can work with these 5 major risk factors for long-term conditions and premature death, then actually you can make a biggest impact. And we know that often the burden of disease is heaviest for those who are least privileged. So it's kind of, how do we do that together? And obviously we need to work with people on that. I'm more than happy to share more about that. If you can go on to the next slide, the key thing I really wanted to leave you with was, and hopefully majority of you have now had a vaccination, may have had your first and second vaccinations, but there's been a huge amount of joint work between the Royal Borough of Greenwich and the clinical commissioning group, working with our GPs to run the COVID vaccination programme, working with Oxleas and LGT as well. So we've now done over 120,000 residents have had their first dose and 74,000 have had both. We've got a real focused effort on engaging with our communities where there's been less confidence in the vaccines nationally. And that's been absolutely vital to try and make sure that we don't widen, but we actually narrow those inequalities that exist. And so it's about having conversations, understanding people's concerns, providing factual information in cultural appropriate ways. And Fiona's already mentioned some of this work we've done with community influencers and faith leaders. Hopefully some of you have seen this, but we've had the vaccine bus, we've had pop-up clinics in several temples and churches, produces videos in a whole range of languages. I think there are over 46 of these different videos there. We've run more than 30 webinars with different community groups and done some sort of facts campaign, which features Moses and Asher, who are 2 Greenwich residents. And we know that as a result of this, in 1 month alone, we saw a 20% increase in uptake amongst the African residents and a 12% increase amongst Asian residents and a 12% for Caribbean residents as well. So we know that our white uptake is still higher, but we've done an awful lot to do. So please work with us on that. The next stage will be doing an outreach program with our communities, with Royal Borough of Greenwich community, the Community Trust from Charlton Athletic. And we're going to be going to about 50,000 doors to try and really target people in their homes to try and help encourage that uptake, because it's so important for us. And I will hand back to Fiona just to summarise how you can get involved.
So I'll be very quick because I think these will be shared with everyone. But actually we've got, if people sign up to be a community champion, then we can get messages out to you and your friends and your neighbours, and we can try and sort of support you in sending that on in a format that actually works for your network. Being involved in, if living in one of the 7 neighbourhoods, so that's sort of Plumstead and part of Plumstead and part of Glendon, Thamesmead, Charlton, Woolwich Common, Woolwich Riverside, the Page Estate, which is kind of West Eltham, and part of the peninsula, which is Caltock and Flamsteed. Those are the areas we're concentrating on at the moment. If you live in or around one of those areas, please get involved. That would be really, really good. We need your feedback. We need to work with you. And our community of interest, I can certainly let people have details of that, but also the other work that we're starting to do. We can't redesign services unless people get involved, and we need people to get involved in in the practice participation groups, in the work that the NHS is doing to help us understand how we make it better, because we don't always know. So these are the areas you can get involved in. Thank you.
Thank you, Neil. Thank you, Sarah. Thank you, Fiona. I'm going to go to the audience first for questions. Can we start off with Eleanor, please? Eleanor?
Hi, I'm going to start my video. Can you see me?
Thank you. Yep.
Hi. I think my question I put on the chat, and it's basically on the diversity of the BAME community. Now, I worked with the Black community, I've worked with Asian communities, but mainly in this discussion, I'm kind of surprised that that diversity is not shown, considering it's the health issue which concerns you know, all of us. I know that especially the East Asian and Southeast Asian are very reticent from my own knowledge, that they don't like talking about mental health or disability, but that doesn't, the more they're reticent, the more that their voices are not shown. But if you don't work with them, then they're really not seen. I guess that's my question, is because I'm kind of new to this. I work mainly on disability, but I've engaged a lot these days also on the BAME or BIPOC issues. So I'm just wondering, and I'm not seeing in the figures, and I would like to know more about what has been done with those communities.
Thank you, Eleanor. Who'd like to answer that question?
Can I come in here, actually? I think, Eleanor, I think we recognise when we've been trying to work with communities of interest, we've recognised that that is an area, the Southeast Asian communities, particularly the Vietnamese, we are struggling to link in with them. We need some people that we can contact, we can get in, talk to how we actually get engagement into those communities. And as you say, they probably have been very reticent and very quiet and not come forward. So any help that you could provide to us, that would be really, really welcome.
Can I just as well, Joy, to say, so I mean, I think that was the point I was trying to make, really, Eleanor, that every community is different and will have particular issues. So those issues that you referred to in terms of stigma in relation to mental health or in relation to disability, they may exist in lots of communities, but they may take quite different forms. So I think that the work that Fiona's described with quite a lot of different communities of interest, as well as thinking about different neighbourhoods, is trying to begin to have those conversations. And so I think there's an offer there, particularly in relation to the Southeast Asian community, to let's develop that network as well.
Can I raise something else as well, which I've noticed?
Just one more question, Eleanor, because I've got a few more in the chat.
No, it's not. It's just a comment. It's a short comment. And we mentioned racism, and I'm hoping that there may be more voices because of the Asian racism because of COVID-19. So I'm hoping that more voices will come because of this awareness.
Thank you, Eleanor. Pamela, you've got your hand up.
Come back to me. Sorry, come back to me.
Okay. Sorry. And Patricia, would you like to speak?
Yes. Good morning. I'm sorry I was late joining you, but I recently moved into a 5th floor flat in the Dockyard. So I don't really know a lot of people, but I realise that there's a lot of people living here. And there's probably lots of different nationalities here as well. And what I've discovered since I moved in last July, that not a lot of people actually go into the Clock House, which is the community centre right in the middle. And that surprises me tremendously, that people don't know that they can go in there and that it's a nice, friendly place. But as part of going from your point of view, how do I try and be part of these different communities here? Because I'd like to be. I think one way is perhaps being on that patient participation group. The surgery is, well, the chemist is just across the road from us, and Ferry View, my surgery, is not very far away, in walking distance. And I think there are other 2 surgeries, smaller surgeries that are in walking distance from here.
Thank
so
you,
my
Pam.
question,
can I just ask, is your question about how you can get involved?
Yes.
Okay. So which of the speakers would like to answer Pamela's question about how she can get involved in all this stuff that's going on, how she can be a part of her local community?
Can I just say, if you live in Woolwich Riverside, Patricia?
Yes.
I can put you in contact with one of our neighbourhood groups, and they will help you to get involved, but also if you've got specific areas that you want to get involved in, specific communities you want to engage with, they will help too.
Oh, good. Excellent. Okay, thank you.
Thank you. And Pamela?
Yeah, sorry, I lost my question on the paper. The question I have is, Fizz, thank you for all that you shared just now, and I was quite interested to see one of the slides was about the COVID-19 and the vaccine, where most of the people you illustrated were of ethnic minority. One of the things I think Fiona said was people not getting involved. I could tell you partly why in my community some people don't get involved. There's a lot of other illnesses that affect them. It has been for many years, and they've been trying to get their voice to be heard, and they've not been heard. Then COVID-19 appear, Black Lives Matter appear, and then all of a sudden we've become flavour of the month for what you want us to be flavour of the month for, which is the vaccine. But people's been suffering with high blood pressure, sugar diabetes, fibroids, the maternity issues with the women in maternity who've always wanted their voices to be heard, wanted to have a dialogue, but it's taken a pandemic to get you to realise that our lives matter, and yet our lives matter 70 years ago when my parents came here to be nurses. So it's not something that wasn't there, but yet the illustration is focusing on the vaccine, but not focusing on all the other health issues that people are going through on a day-to-day basis that's not being addressed. And that's like the sickle cell unit, I still can't understand why that was closed down. And yet 66% of the population in Thamesmead are from Black and African and Caribbean community, and the sickle cell centre. Our voices are not being heard for the things that's important to us, but you want us to hear your voice for what's important to you, which is the COVID-19. So I think this platform, and I thank Joy for doing it, has allowed us to have a voice for other things, but voices need to be heard for other day-to-day illnesses that people have to be dealing with longer than COVID-19, and it hasn't been heard. And the final question for all of the groups is, what is your staff morale like on the inside of your organisations? Because if the staff morale is low, that people of ethnic minority are disproportionately reprimanded, or your turnover of staff within the Black and minority ethnic is higher, then there's something seriously wrong with the management of the organisation in actually being able to keep good staff to work with you, to make what you're doing from the inside work for you on the outside.
Thank you, Pamela. So we'll take your first question first, and that was specifically about services that disproportionately address the needs of Black, Asian and minority ethnic communities, and a feeling that actually voices are not heard when communities say they actually need and want those services to continue. That doesn't always happen. So I don't know who's best placed to.
I'm happy to start. So I mean, Pamela, I'm going to apologise on behalf of the NHS because I think it's not that people's voices aren't heard at all, but that the fact that you don't feel heard is really, really important. And I think the challenge is very often services are commissioned on a universal basis, which means they're available to everyone equally. But I think the same concept of a storm, you provide services universally, that doesn't mean they're actually universally available. There are some people who have more barriers to access those services than others, and the cultural competence of our services isn't what they always need to be. The training of our staff isn't always what it needs to be able to support that. And I think this last year has been a big shock to the system in a pretty horrendous way, but a positive way. And I think there's a real commitment from across the health and social care system for doing something different about that. I guess our focus on the vaccine at the moment is because we know how important it is. And as we do this work, we're granular down to kind of patient level information in order to be able to identify this. And we know that there's a lower uptake in the vaccine amongst certain communities, and we need to reach out to them. But this isn't the end of the journey. This has got to be the start of a new way of working together in a different way. And Pamela, I know we've talked together about how do we work with your particularly Afro-Caribbean community and how we support you. But the work that I mean, I can share more detail about the Vital Sign 5 work, but the issues around obesity and about blood pressure is the biggest single cause of disease. And we know we've got huge numbers of people in our communities that don't have their blood pressure well controlled. And we really need to do a targeted piece of work. And the good news is we can use data to drive that, because we do have a lot of that data at a patient level. And what we need to do is a similar targeted approach, but we need to work with communities around that engagement. Too often people might be said, oh, well, here's a great diet, and be given a very white diet advice, which is nothing to do with the cultural diet that person would normally have. And actually, you can actually change that advice and make it much more appropriate. So there's a lot we can do to change how our services work. So we look forward to working in partnership with you and other groups going forward. And in terms of the point you made about morale in our organisations and turnover, I mean, I'm sure after this meeting we can provide the data for all of our organisations. I think quite a lot of all of our organisations have been doing a lot of detailed work with the different communities that make up our organisations, and I think there's a groundswell of change. And I think, as was said by, I can't remember her name now, from Oxleas, but there is an internal revolution that's going on in our organisations as well as an external one. And I can see there's going to be real change that will happen. But you do need to hold us to account for that.
Thank you, Neil. Can I ask representatives from Oxleas and Lewisham Greenwich Trust to say something about staff morale as well?
I also raised my hand, John.
So is it okay if I go ahead?
Yeah.
I think, like everyone, the last year or so has had a massive impact on NHS staff, and I think some staff groups in particular. So whilst some areas of health were kind of diverted to COVID and some services were scaled back, like community learning disability services, people like our community nurses, our district nurses, have never been more under pressure and in demand, often picking up care for people that perhaps GP practices weren't always in the place to be able to do that. So, we were still seeing people, we were carrying on, and in fact, demand grew. So I think in particular, I would like to sort of give a shout out to our community nurses, because they have just worked extraordinarily hard, as has everyone in the NHS. But I think we have an annual staff survey that tracks things like morale of staff, amongst other things. And we're just looking at that data now to see how that differs from previous years. Initial look at it, some areas have actually improved. People feel like their well-being is taken more seriously, for example. But we know other areas are stubbornly not moving. And that's why, through work we're doing, like building a fairer Oxleas with our staff, is about tackling some of those things. So, for example, the number of our staff, particularly Black, Asian and minority ethnic staff, and disabled staff that experience harassment, abuse from patients and the public has remained high even during, you know, the pandemic. So that is something we definitely need to address. We're working with the Metropolitan Police to looking at under a scheme they've got called Operation Cavell, looking at how we seriously address violence and aggression towards our staff, and actually dealing with that. And where we're running some pilots in some wards, it's actually reduced the incidence of violence and aggression against our staff by about 40%. So, you know, we're looking at it from every angle, but we appreciate that this has been difficult for everyone. But I think morale is variable across, you know, teams and services. So I wouldn't like to say, oh, it's fine, it's great, because actually everyone has been working so hard. I think people are exhausted, actually. And we know from some of the data coming out nationally that a number of health staff are saying they're going to leave the NHS. So it's really important that we look at our staff's well-being, because that will also impact on patients' experience. You know, happy staff, valued staff will provide better quality care. We know that. So we need to prioritise that, and we're doing a lot of work now around looking at the well-being of our staff and what support we put in place. A lot was put in place during the pandemic around people to talk to, apps, free access to apps around well-being, all these things. We've had various like little welfare packages going out to staff to say thank you and to support people, but you can never do too much of that. You know, it's not something you just say, oh, we've done enough, that's fine. So, you know, we are doing a lot, but we could always do more.
Thank you, thank you. And Sandra and Faye, I don't know, you did talk a bit about what's going on with staff at the Lewisham Greenwich Trust, but I don't know if you want to add anything to what you've already heard in terms of staff morale at the Lewisham Greenwich Trust.
Yeah, I think I would agree with a lot of what Karen has just said. Morale is variable. People are exhausted. They're really, really tired. And we have, as an organisation, been doing very, very similar things, trying to really put in place the breadth and depth of things that would support staff wellbeing, including sort of loads of mental health awareness trainings, physical activity, just making sure that managers are skilled up to have those wellbeing conversations with people, thinking about the ways, some of the positive impacts in terms of agile working and where people have found those beneficial, and just looking at ways that we can continue to do that. Just right across the spectrum, really, what we completely understand is people are needing different things at different times, and we're trying to make sure that we have a really robust package in place to be able to address those needs as and when they need them.
Thank you, Faye.
We're going to continue doing that.
Thank you, Faye. I've got a question, just going back to the point you made about all the work around vaccinations, Neil. So there's a question in the chat about reasonable adjustments in place to support the COVID vaccinations of individuals with learning disabilities and autism who might not find it easy or readily engage with the process. So I wonder if you could say something about what's been put in place for residents with learning disability and autism to support them to receive the vaccine.
Yeah, so a lot of our GP practices have been doing home visits for a number of people. Obviously, there are a number of people who are in kind of sheltered schemes and care home settings, so they've had kind of targeted visits, and so they've been done. We've had a really good uptake. I think it's 93% in all of our care homes, but obviously individuals, it's about sometimes that's been done at home, but there are some people who have particular phobias or concerns about needles and things like that, and so there is some targeted work going on across South East London about some specialist kind of clinics. So some people might actually need sedation, and obviously that's a more complex process, and so that's something we're working on together. But if anyone's got any particular concerns on that, then let me know. But one of the things I actually lead on learning disability and autism for South East London as one of my areas of kind of responsibility, and we were arguing very early on in the process to make them a top priority cohort, given the early mortality and the information that we were getting on that. And yet we know that they were prioritised as sort of level 6 in the overall national system. But we were able to start that process earlier so that people have got earlier access to the vaccine. But if anyone's got any particular information that they would want on that, I'm more than happy to work with people to ensure that uptake is improved. There is particular materials that's also been produced with easy read, there's videos, and we've run a number of particular sessions working with advocacy groups to help on that. So hopefully that helps clarify.
Thank you, Neil.
Enjoy, but can I come in as well? So
Please do.
I mean, I think on that learning disability question, we've done quite well actually in making it accessible, and you know, certainly there's people that are in borough services. There's been a really good uptake. I wanted to come back to the, that question or the point that was made really around what are, you know, I think we recognise there are issues about trust, and you know, now you all want us to take the vaccine, but actually these are the health issues that we've been really concerned about over a number of years, and these should be given more priority. And I think Neil responded to that, but I just wanted to add that, so I sit actually on the health, the London Health Equity Group that Neil referred to, so working with Professor Kevin Fenton on, so it's not just about COVID, it's very much about, so what needs to be different in the future? How do we think about health services and patterns of investment in a very different way? And what are those things that we need to that are important to people that we need to focus on? And there are sort of those kinds of conditions that Neil talked about, but it's also thinking about whole people in their families and communities, because often those things are just symptoms of a sort of wider set of circumstances. And I think what's interesting about the vaccine programme is we have worked in a very different way and resourced things differently in terms of trying to make sure that there's equitable distribution of the vaccine, if you like. So I think the question is, what's the learning from that, and what would that mean going forward in terms of all the other, you know, conditions that were highlighted? So I just wanted to add that. And then on the, in terms of the well, certainly health and adults in the council, and perhaps the council more broadly, that question about staff morale. I mean, I've been really, so I could say similar things about you know, all of the data we collect and how that gets reported, and the, you know, exit interviews and the training that we've had, and enabling those difficult conversations, as I said. But I think what I've been really struck with is that we've seen a huge amount of change actually over the last year in the way that we organise and respond, and you know, shifting practice to being much more focused on what matters to people. And actually people have responded to that really well. So it's, you know, despite all of the challenges that we know about, I think, you know, what our data suggests is that staff are much more engaged, and that sense of shared purpose that we've all had has been, you know, really valuable and really important. So I just wanted to add that on a positive note.
Thank you, Sarah. I'm very sorry to everyone that's got their hand up, but we're actually running out of time. If I can ask you to put your questions in the chat, we will answer all the questions. We'll produce the questions and the answers on our website, and the slides will also be available on our website. Anastasia is going to put up a short poll in a minute, just so we can get some indication of whether or not you found this session useful, and if you'd like us to do something similar in the future. We are going to be inviting our speakers along to our Healthwatch Black, Asian and Minority Ethnic Advisory Group to give us more detail, and for us to have a longer discussion about the work they're doing and how local residents can get involved in shaping and developing that work. So again, if you want to be involved in that, do drop us an email. So I'd just like to finish by thanking you all for coming, and particular thanks to our speakers. Fantastic slides, great opportunity to hear what's going on, and hopefully the opportunity for you to hear the thoughts of local residents, and hopefully this will encourage more people to get involved with the opportunities that are available. Thank you all for coming, and pleased to report that looks like we're going to finish probably a minute or two early, but please don't forget to take part in the poll. Thank you very much.